Hello, I'm Esme and I co-run the Dizzy channel with Jez, as you may know. I'm just doing a little introduction clip before the video that you're about to watch. I've posted on here a bit about how chiropractic care has helped me with my vestibular problems. And I just really am passionate about getting more information out there about it because it's not something that you maybe easily come across as a potential method of managing vestibular symptoms. And I know that there are a few questions in the community about these kinds of treatments. And it took me over a year to come across it as an option. I was just Googling things about what might help me. Came across online some things about the potential link between vestibular symptoms and the neck, the upper cervical spine, and the inner ear. And so that's how I got to be treated at Atlas Chiropractic Clinic in London, which is an upper cervical specific clinic. So it's a specialist type of chiropractic. So I really wanted to get someone on here to talk a bit more about how it works, someone who practices in the same way as the treatment that I got. So we're really lucky to have Dr Christian Caswell agree to speak to us about it. He runs Top Chiropractic Clinic in London. So he's also an upper cervical chiropractor. So in the video we talk about how this type of care works, what the treatment looks like, and how recovery can look for people, how it relates to other types of ways that people are managing their vestibular symptoms, so medication, VRT, massage, things like that. So I hope it will be really useful for people who want to know a bit more about this kind of approach. A bit about Dr Christian. He graduated from the UK's biggest chiropractic college, so that's the AECC, the Anglo-European College of Chiropractic. He's also in the esteemed Academy of Chiropractic Philosophers, and he serves as one of 12 directors on the board for the International Federation of Chiropractors and Organisations. So he really knows his stuff. So we're really glad that he's agreed to speak to us today. So I hope you enjoy hearing a bit more about that, and I will start the clip now. Thank you so much for coming on and chatting to us. So if you could just start by explaining what is upper cervical chiropractic in a nutshell, what happens in your office, what do you do with people who are dizzy or who are having vestibular issues?
So upper cervical chiropractic is maybe like a branch of chiropractic. We have full spine chiropractic, which most people know of, and then upper cervical is another branch of that. And upper cervical chiropractors are concerned with the top part of the neck, the upper cervical region, and the way that that affects globally the rest of the body. And the reason why this area of the spine is so important is because of the area that it surrounds within your nervous system. These small bones here, which I've got a couple here, they surround an area of your nervous system called your brainstem. And your brainstem is what coordinates all the internal functions of your body. Also gives a lot of, this area of your spine also gives a lot of feedback back up to your brain about something called proprioception and where your body is in space. So when we start to get changes in this area, it can have huge global effects on people's bodies, and that can range from dizziness and balance issues to internal problems such as digestive problems, which can also go hand in hand. So we understand that when this area of your spine is working correctly, then your brain can communicate much more efficiently to your body. But when it becomes misaligned, or as chiropractors we call that subluxated, when that becomes subluxated, your brain can't get that information out correctly to your body, and your body can't get the information back up to your brain. We get this disconnect, which is when people start to break down and then they end up in our office. Our office is quite, if you're like, it's going to be very different. An upper cervical office will be very different to a standard chiropractic office. There's a lot of different procedures that we use. We use a lot of resting before and after we've done anything. So we use pre and post checks using this instrument here. And this is like a functional nervous system scan. It scans your spine and it tells us how well your nervous system's doing on any visit. And we can tell if your spine then is in alignment or out of alignment. If it's out of alignment, then we make the corrections to your neck, and then we rest your body afterwards, and then we retake these scans again. we start to see your body changing, adapting. And ultimately, what that means for you as a patient is that your body is now able to heal and regulate and function at a better level. So that's what we do in our office. We use imaging such as X-rays or CT scans to analyze the position of the joints. So it's a lot more scientific in a lot of ways. So we do a lot of in-depth analysis before we do anything.
Yeah, great, thank you. And what does the adjustment actually kind of achieve? And is that usually with your hands? What does it look like?
So in the practice that you've experienced and that I do, yeah, it's all done by hand. And the correction, what we'll do is we'll take the measurements of your misalignment based on your imaging, and then we'll make a correction based on that to move that bone back into the correct place. Some people use a hand, like our practice. Some people will use an instrument. But ultimately, the goal is the same thing. It's to restore the integrity of that joint and move it back into the correct alignment so that your body can then start to function at a much better level. But yeah, there's different methods. Some people will use an instrument, some people will use the hands, but all of it's very safe because we do a lot of pre-testing before we do anything.
And do you work on other areas of the spine as well in your practice, or is it mainly just the neck?
No, we don't work on anywhere else. It's just we really just work on that area. But when we do work on that area, because this area is so powerful, and because of where this surrounds, when your head becomes out of position and your head isn't sat on straight, we start to see your body compensate through all different regions. And when we do correct this, we'll start to see a lot of full spine changes in people just by correcting the neck. So I used to work in a full spine practice where I'd adjust all sorts of areas, but then I found that just working on this area, I was getting such better results. People were seeing much better effects, not just with their problems up here, but globally in their body, that it made so much more sense for me just to keep working on here and become really specialist at it. We make it really clear that we're not, when someone comes in, that's not what, we're not going to go down there, because it depends on what people are looking for as well. What we do is quite specialist, and if you don't know what you're coming in for, it can be a little bit of a, like what's he doing? I've got a bad hip. Why is he looking at my neck? But yeah, we understand that when your neck has become misaligned and subluxated, we start to see these global problems in people, and I've seen so many people. And even when I was transitioning from a full spine work to this upper cervical work, I would look after some people who had lower back problems, and I'd been looking at their lower back for a long time. And when we started adjusting their neck, their lower back cleared up, and it just made me realize, okay, I was getting blinkered in, looking at these symptoms too much and not taking a step back and treating the body as a whole. We'll notice as well that when the neck becomes misaligned, so the goal of your brain wants to keep your eyes level at the horizon. So if your neck becomes misaligned and your head comes out of position, then what we can start to notice is that you can't walk around like this all day. Otherwise, you're going to have problems. So your body compensate, might be down on one side. Then we'll notice that your hips will start to change. Now, if you're walking around on that all day and your body's in a contorted position trying to protect something up here, then it doesn't matter if you look at the lower back and try and work on the muscles down there that are tight. They're going to be tight because they're trying to hold you in a different position, so your head can stay right. Yeah, that's why that happens. You get muscle contractures and all sorts of other places to maintain your head in that right position. But if you do get sucked in sometimes to looking at the symptoms and looking at where things seemingly come from, you can be misled quite easily. Your body's really clever, and it'll do as much as it can to keep you going, so it's best not to try and second guess it.
And your body can go quite a long time with an issue without you having any pain or symptoms, isn't that right? Because when I worked in a chiropractic clinic, I remember being taught that the pain is actually the last point of dysfunction or the dizziness or whatever it is. Yeah,
usually it's like the straw that breaks the camel's back, right? So your body can deal with all sorts of things. Eventually it gets to a point where it's like, you know what, I can't deal with it anymore, and that's when people start to get these problems. But the thing is like this, but it can take a little bit of time just for your body then to reintegrate and to remove. And it just shows us that it is a process working with people. And it does take time to get them back to fully in, a lot of people understanding that, this took a little while to get to where you are now, and it will take a bit of time to get your body into back in a healthy position, but it's doable. Your body's got the ability to heal and regulate, so we know that given the right environment, it will do that. And that's what we do as chiropractors. We remove the interference so your body can then start to communicate and function and get in that right environment.
Yeah. I mean, on that note, I guess people might be wondering what causes those spinal issues in the first place. What might lead to those problems?
Yeah. So the way that your body works is, it, like we said, it can deal with a certain amount of stress up into a point. And it doesn't really matter what type of stress it is. And working with people now, physical, chemical, emotional stresses, they play as much of a role in people's bodies as it doesn't necessarily just have to be physical things, and your body can deal with them up into a chemical emotional stress. When it gets to the point where it's no longer able to adapt to it, we find that your body then starts to break down, and that's what we as chiropractors find that causes a subluxation. But the stresses that your body are under, they can be things such as prolonged postures. So we see a lot of people nowadays sat at phones like this all the time.
Yeah.
And this sort of flexion extension, this flexion. And the motion that actually primarily comes through these joints here, I don't know if you can see this, but this rocking motion, this flexion extension is where that's the top part of your neck is where you get that motion from. So if you stress your body out and look down like this all the time, then you're basically stressing out that joint. Eventually, the same thing, you straw that breaks the camel's back, your body gets to a point and it's like, I can't deal with this anymore. And that's when we find it happens. But it can be all sorts of other things. There's been a lot of all sorts of other stresses going on. Emotional stresses have been at an all-time high for the last 18 months. Chemical stresses are all around us all the time.
Yeah. Is that because when you're stressed, you hold yourself in a certain way, or is it more like just the hormonal changes that happen when you're stressed?
Yeah, it's a combination. So your body only has so much capacity to deal with stuff, doesn't it? You can't just keep unloading it, unloading it, unloading it, unloading it on. So if you've got a huge amount of when your body is in a emotional state, it releases a certain amount of hormones. It releases cortisol. It releases all sorts of things. So that then just puts your body at a less, if you like, strong and less adaptive place, and then that's when things start to break down, because you sort of hear it all the time that people have it's just a constant build up of things, and then eventually and it wasn't a lot of people say, like, I bent down to pick up the washing basket that was empty on the floor or something, and then something happened, and it's like, you could have done that a million times and it wouldn't have caused it. But why was this one time the time that set all your issues up? Well, it wasn't that one time, but it was the accumulation. It was your body wasn't in the right place. It was a whole range of different things. But when that happens, we see that people's spines become misaligned, and we start to see these problems creep into people.
So for vestibular issues, what kind of presentations do you see in your clinic? What kind of issues do people come with, and how does that relate to, do they always have neck pain as well, or is it sometimes just the in-area symptoms?
Yeah, that's a really good question. So the usual story of someone that comes into the clinic is usually quite similar for a lot of vestibular problems. They've had MRI scans, they've had hearing tests, they've had someone's looked in their ear, they've had all of these tests, and the doctors have said there's nothing wrong, it looks normal. Which then leads them clutching at straws, like, well, why am I experiencing these vestibular problems when all the tests are coming back normal? And then that creates a whole other range of problems. So that's usually when people then look up Upper Cervical Chiropractic or find a link between the neck and the ear, and then come to one of our offices, which I imagine probably happened to you, did it not?
Yeah.
So in terms of the cases that we see, vestibular problems, it doesn't necessarily matter what type of vestibular problems people have. Some of them may respond better than others, like BPPV, doing Epley's maneuver and things like that. That might be more suited for some aspects of the dizziness. But in terms of like other vestibular problems, like Meniere's, PPPD, we see a whole range of them, and it doesn't necessarily have to come with neck pain or symptoms. We see a lot of vestibular migraines as well, because migraines also just really respond well to upper cervical care. And the reason that this area of the spine does respond so well is because when we look at, I think it's because of three reasons. The first reason, again, when we look at this, I'm going to use the big model so it's a little bit easier. When we look at this area of your spine, what sits in here is your brainstem, and your brainstem is what's coordinating all functions within your body. Gives rise to the vestibular cochlear nerve, which comes out and gives innervation or information from the middle ear, and it communicates from the ear to the brainstem and then up to the brain. So a lot of people have had tests looking at the ear and looking at the brain, but they haven't had the linking bit in the middle, which is where we look at. The other reason is that when we look at what passes through this here, which is the base of the skull, all the fluid flow around your brain, CSF flow, and then the fluid from your inner ear will come and drain through here as well. When this becomes misaligned at the top, when your upper neck becomes misaligned at the top, you're going to start to put a kink in that, and you're going to start to change what's called the hydrodynamics, which basically just means the fluid flow into and out of your brain. And when you do that, then if you're not draining stuff out properly, you can get that buildup. And when we get that excessive buildup, then we can start to get problems in terms of Meniere's disease, which is that fullness. And then we get to a point where you're having the drop attacks. So that can also, I think, can come from there. And then the third reason that I think it happens is when we look at where these joints are. Cervicogenic dizziness is quite a big problem that people come in with. These joints up here, so these upper cervical joints, like I said, they're just packed full of receptors which are feeding information back to your brain, and your brain back giving information out to your body. So if we've got a misalignment here, we can get that faulty feedback back into your brain, and your brain's trying to work out what's going on, but it doesn't quite get the full picture. And that's again when people might start to feel that unsteadiness and that dizziness and those problems as well. So I think there's a three-part problem, probably even more, but that's what we've found has been, that's what we've found in the office.
Is there research on this link that people could access, or is it more like you have to do the training to get that information? Because I think people, it's obviously, it makes so much sense when you're going through that treatment, but it's at the same time it's just not something you're told by your GP or anything like that. So is there anything you want people to get some more clarity on that?
Yeah, there's a lot of research. It depends what sort of research you want to look into. Case studies, we see them all the time in the office, and there's Vertebral Subluxation Research Foundation, which has loads of case reports coming out across chiropractors all over the world, and the results that they're getting with people, and a lot of them have vestibular problems. There's a really good podcast or YouTube channel with what I think sums this up really nicely, and they just deep dive into research papers, which I can give you the link to, and maybe you can post that alongside it. But that really explains how that fluid flow works and how all that works, why that's so important to brain health, and the way that the body's working. So I can send you some of that as well.
Amazing, thank you. We'll talk about what kind of impact obviously those patients that you've described see with your method, but I also wanted to quickly just ask about the difference between how you would treat someone as an upper cervical chiropractor, and then a more kind of mainstream chiropractor, and then there's also things like osteopaths, physios, because I know that people can feel a bit like, what's the difference between these? Which one would be best? You know, a bit overwhelming.
Yeah, 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 and the problem probably comes from us as professionals not defining exactly what we do from the start and all having our own little spin on it. So yeah, it's a good question, because I know you can be lost. But when we're looking at traditional chiropractors, for the most point, we're going to be working on the full spine, so, and maybe even into extremities. Mostly they'll work on making adjustments to the spine to improve movement of the joints. But then also doing, they may do soft tissue work and putting needles in people. At the moment, that's majority of what chiropractors do, and it looks a lot like osteopathy, and it can look a lot like physiotherapy. Upper cervical chiropractors will look more at the alignment of the joint. So rather than trying to increase movement, I'm looking to improve the alignment. So it's quite subtle, and the application might look exactly the same. Before we do anything, we always do pre-testing. So a lot of the time that's using thermal scanning. So that's what we use as an outcome measure. And we do that before and after, and we use what's called resting to get the body into a relaxed state before we do anything, and after we've done something to measure it. So that's quite unique to us. Where we do things, rest before, take the measurements, make the corrections if necessary, rest again, retake them. And the goal is to improve the alignment to allow the nervous system to start communicating and functioning and healing better. Whereas you probably won't get a lot of that in a traditional chiropractic office. Most of them will look at the joints, make corrections to the joints, and it can be to improve the neurology at that level and improve how the brain's perceiving the body at that level. And more traditionally, more in school now, what they're teaching is doing a lot of rehabilitation and things alongside it, which really blurs the line for people. Chiropractic is usually a private practice as well, so it's not something that you really get on the NHS. Whereas physiotherapy is obviously, you usually get that first on the NHS. And with physiotherapy, it's not a lot of hands-on. Usually at the moment, physiotherapy is a lot of standoff, exercising and rehabilitation sort of things. So if you're wanting something hands-on, then the chiropractic side is probably more where you're looking at. Physiotherapy is usually a hands-off approach. And osteopathy practice to be like full spine and traditional chiropractic from the outset, that they'll use maybe more mobilizations rather than manipulations, but some osteopaths will use some manipulations as well. There's not a huge distinction at the moment between the chiropractors that are graduating and what they're getting taught, and osteopaths, from what I can see. The main distinction is when what we do is looking at upper cervical work. It's a lot more specialist, and it's a lot more looking at the neurology around things rather than just some musculoskeletal things.
So what kind of impact do you see with those patients coming in with vestibular issues, and what does the recovery tend to look like? Is it quick? Is it linear?
Yeah. So it ranges. Not everyone gets fantastic results like within the first few visits, but it is rare that people don't see some sort of change under care in a positive manner. When we look at vestibular problems, usually one of the things that people are really concerned with as well is tinnitus. So that's something massive that people will come in with, and it's not, because that can be really debilitating for people. That one's one of the most tricky symptoms for people to get under control with people, because of something we spoke about earlier off camera, like neuroplasticity and your brain learning what's going on. So we can chat about that as well. That one is it's the hardest to predict how it's going to change. Right. Sometimes people see some good changes in it, but in terms of dizziness and vestibular problems, the dizziness aspect, we see some we see them reducing. They don't usually switch off like this, although sometimes it can happen. Usually we see people having less incidents of maybe attacks. Then we see the intensity drop, and then we start to see, okay, we haven't had one in a week, and then it's not necessarily that it'll just flick off like a switch as much as we'd like it to. Yeah, although sometimes that does happen, and when it does, we're really happy. But yeah, it's not always straightforward either. You know, sometimes as we make these corrections, it's a lot of input into your brain. Your brain starts to get more information from the body. You can start to get a little bit of an increase within, you might have an attack, but it doesn't necessarily mean that anything bad's happening. It's just your body getting more information, working out what's happening. And if we can make sure that we monitor you closely, and usually in the first part of care, especially with vestibular problems, we do monitor people closely, so we can reassure and make sure that everything is going on track. If things do get a little bit worse before they get better, it's not a worry. I know it can feel uncomfortable, but like doing anything sometimes, yeah, anything that's worth doing isn't easy. Sometimes it can be a little bit uncomfortable in the first instance.
So your kind of perception as the practitioner of their progress wouldn't necessarily match how they were feeling at the beginning, but that wouldn't be a red flag.
Yeah. No, that's a really interesting point. No, exactly. So we don't go on the symptoms as an indicator for how well someone's doing. Obviously, it is really nice when symptoms are improving, and that happens eventually. You know, what we use is the objective neurological testing, so the scanning of the spine, to look at how well the body's changing and adapting and healing. Because when we know that that's happening, I've got every faith in your body that it will start to heal and it will start to regulate, and it'll just be a matter of time, you know. So when symptoms are extremely subjective. Like like with someone with vestibular problems, you'll know that one day you can be feeling great, the next day you can be feeling rubbish, and you didn't do anything different. So if we were to judge your health based on your symptoms, one day you could look healthy, one day you could look sick, but matter of fact is you're the same person, you know, from day to day. So we use the objective tests to then guide us how well your body's doing. And in the first part, yeah, it might be a little uncomfortable. Over time, we try and explain to people that it's not like a one-day thing. These problems can have been in there for a long time, and it's a process. But if we think of a couple of weeks, couple of months down the line, rather than one day at a time, in 6 months' time, we're usually on the same page where our tests are going well and your problems have gone and we're all happy. But it's just that first part can be a little bit of a wobble for people. So we keep a real close eye on people in the first part.
And is there a point at which people just stop needing to come to you? What happens after they are doing a bit better?
Yeah, well, it's complete personal preference, you know. We usually set out a plan of care for people, which can range from 4 to 6 months, depending on the case, in varying frequency. But at the end of it, then it's up to the individual, you know. What I recommend, and what I do personally, is that we recommend that if we can keep an eye on it and keep you checked over once a month, once every so often, we can be sure that this isn't going to creep back in. Because like you said earlier, pain and symptoms and dysfunction is usually the last thing to show up. So if we wait for that to all come again, then we've got to go through the full process again, and it's not good. But those problems can creep back in. So we usually recommend that if you keep a check on it every now and again, make sure that you're doing well before symptoms start to arise. If something's really adding to your health, we recommend, I don't know, you keep it up, you know, going to the gym, the same thing. If you get to your physical fitness that you wanted to, that's maybe not have to do it so much, but still keep going. Otherwise, you'll see it drop off. So it's the same thing with your health.
Yeah. I just wanted to touch on the tinnitus thing that you mentioned as well, because I definitely noticed that would change almost every time I got adjusted. That tinnitus it wouldn't necessarily be gone just after the adjustment, but like the tone of it would change, which would reassure me that something was happening in there. And then I would find kind of like by the next day it would be a lot quieter or it would be gone. So that was really nice.
Yeah.
But I
and that. Yeah, I love the way that you put that as well, as the way that so it's changed, so it's
Yeah.
something's happening in there, that when we make corrections but nothing changes in terms of those, that's when I'm more concerned. It's like, um yeah, I want it to change, whether it's like it changes pitch or it changes volume or something happens to it. That means that it's not as just ingrained in there. For
Yeah.
me, it means it's not as like neuroplastically just wired in there, and that something can change about it. That's a good sign, like you said.
Yeah, because I would often feel some fluid draining as well from that ear, because with me it's my left ear that tends to be bad, and
Yeah.
that's always encouraging. But I think because people can be so anxious about, their symptoms getting worse, so I think any change can feel quite bad in a way. Like you can worry, like, oh, it's changed, so that
Mm,
means that my neck is now worse, or I'm going to get more dizzy. But like with Sophie, really helped me to just
yeah.
relax about that and be like, your body's just changing things around, like it knows what it's doing. But that can require just that reassurance from the practitioner, can't it? And that trust in the practitioner, because
Definitely.
yeah, things don't always just switch off, but they can slowly change. And definitely over the next few days as well, following the adjustment. It's not even just instant, is it?
No, your body gets to, it's not the adjustment that actually makes the huge difference, in that moment. It's not the mechanical force that we put in, but it's now that bone and now that upper neck is in the right position, what can happen? All right, now your brain can communicate, your brain stem's working, everything's working. That's when your body really gets to work. So in the days afterwards is when your body's really taking care of the stuff. And that's why we recommend for people to be like resting for the couple of days after an
Yeah.
adjustment. Don't be going straight to the gym, don't be going and doing everything strenuously. Like, now give your body time to do what it needs to do. It's getting the right information, it's in the correct alignment. Now let it start to take control of what it needs to do.
Mm.
um but yeah.
Yeah, and I remember having as well, like a few days after my first ever adjustment, having like a kind of tingly like arm and like a bit of a pain in my shoulder, and I was kind of again like, oh my god, have I been broken? But it was clearly just like the life coming back into that area, you know. Yeah, it's just it does
Yeah,
require a bit of trust.
yeah. And that's really yeah, that's like a really, it's a really important point you make, is that when you've had problems and like chronic issues, your body's breaking down, it's not working for you. And why is my body not doing what it should do? Like, why is it not do? Why does my body not work correctly? I see this all the time. Like on Instagram, I see it all the time. Like, it's your body that's failing you, and it might, yeah, it's not working as well as it should do. But if it's got the correct nerve supply and it's got the correct, everything's working as it should do, then it will. So it's not necessarily your body, but it's the information isn't getting there correctly. And your body inherently will always heal itself. Like if you cut yourself, it'll heal. So we know it will heal. It's always working for you as best as it can. But it can feel like, why is it not working? Why is my body not working? But we know inherently it's going to heal, it will regulate. It just needs the correct nerve supply, the correct environment, the correct things in place, and then it will start to work. But it can feel like, when you've been in a place for so long,
Mm.
that's not the case. So it's just having someone that can help you through that process
Mm-hmm.
and change your perspective on it a little bit, give you the confidence that your body will do that as well,
Mm-hmm.
and then execute it and then deliver the correct correction at the right time.